Well, the extent of the problem is quite serious. There was a study undertaken last year across the local pharmacies where they recorded all of the wasted medicines that were returned to them, and it equated to £12,000 over 2 weeks. That is a massive amount. If you calculate that over a year, it's in excess of £300,000 of wasted medicine coming back. And that isn't taking into account whatever people are stockpiling in their cupboards. So the message from me is that people need to stop, think and consider what they're doing in relation to their medication, because it is a growing problem and that money can be spent elsewhere. It most certainly is. All money that we're trying to gain for the health service is vital. It can go on to major services, or it can even be for employing additional staff. So the key thing from me is I think people need to stop, think and consider whether they do need the medication in the first place, and also what they're doing with the medication once they've got it.
Unfortunately, I think patients order everything that's available to them on their repeat issue every month, sometimes whether they need it or not. And we're not sort of discouraging patients at all from getting the right medicines at the right time. We're not trying to reduce what people obtain on prescription. We're asking people to consider very carefully if they need all those items. If they have them at home and they don't require them this month, please don't order them. It's really important for people to understand that if you don't order an item 1 month, it doesn't get removed from your repeat prescription. That's only done with your consent and the agreement of your GP. So please don't be afraid to decline an item if you genuinely don't need it. So the community pharmacies are going to be encouraging people to consider what they need. They're going to be checking with each patient when they hand their repeat slips in if they need all those items. And they're also starting a new initiative which is around asking patients to check what medicines are in their bag before they leave the pharmacy. And that's because once you've left the pharmacy, no items can be returned or reused. They must be destroyed. And if you discover that you have additional items that you don't need in your bag, if you hand them back at that point, they can go back into stock and we're not charged.